Hi there, this is Dr. John Eickert here at Higgins Physical Medicine, a chiropractor in Hoffman Estates, Illinois. And today I'm going to talk to you about the number one cause of both sciatica as well as low back pain, which is a phenomenon called pelvic rotation or pelvic distortion. So next up, I'm going to show you exactly what that looks like. Then I'm going to give you a really easy at-home test to find out if pelvic rotation is in fact causing your symptoms. And then at the end, I'm going to give you a chance to come in and talk to me about any kind of pain or health concerns you have for absolutely free, because in the end our motto at Higgins Physical Medicine is we do not believe in charging you until we know that we can fix the problem. So next up, let's take a look at exactly what pelvic rotation is. Alright, so before we can really talk about pelvic rotation, I first want to explain to you what a normal healthy spine looks like on x-ray, and then I've drawn a couple different areas of muscles, discs, and nerves so you can see how everything works together. So the first thing that we take a look at on an x-ray is how level the hips and pelvis are with each other. Now it's very important to have that level pelvis because that's the base that the entire spine sits on as it goes up. Obviously the next thing that we'll take a look at is the spine itself, and we like to see that spine, again, going up in this nice straight line, because really what that straight line represents is all these muscles in through here, the postural muscles, are nice and strong and able to hold you in that dynamic and active position so it can pretty much handle anything you throw at it. Another very important factor in spinal health are these discs in between each of the bones. The discs are really there to help absorb all the shock that you put on your body and gives a little bit of a cushion to the spine. All of these structures together work to make sure that the nerves, which come out each side of the spine, are nice and healthy, because these nerves are actually what help control your entire body, and anytime there's a nerve irritation, it will end up causing the pain and symptoms, especially in the low back and then that sciatic pain. So again, the biggest things we need to look at is that the hips are nice and level with each other and the spine is going straight up, and we can even see the spaces in between each of the bones represent how healthy the discs are, and all of that together really determines your spinal health. So next up, I'm going to show you what it looks like when those hips and pelvis start to rotate and cause the problems of sciatica and low back pain. Alright, now that we know what the normal spine is supposed to look like, I'm going to show you what it looks like when a spine is starting to undergo that pelvic rotation. Now, again, we'll take a look. It's the same type of view on the x-ray, but this time you'll see that the hips are no longer level, where this side is typically about 10 to 15 and sometimes even 20 millimeters higher than the other one. As this occurs, the base that the entire spine starts to sit on also will tilt along with those hips, causing the spine to start going off to one side. When the spine starts to go off to one side, a few different things will end up happening. Number one is the muscles on either side of the spine can start to get stretched or strained, and that's why most cases of low back pain start with that feeling of tightness, or you just don't quite have that mobility that you used to. Over time, what ends up happening is that the discs end up under different pressures, and some of that water inside can start to get pushed out in one direction, which can result in either degenerating discs or, even worse, that disc bulge that we always hear about, which causes a lot of pain. Lastly, what ends up happening is the nerves that come out around the hips end up not having enough space and get irritated by both the bones and the muscles that are supposed to be holding those hips in place, which ends up causing that pain that shoots down the back of your legs, either to your knee or down into your feet. Then the last big thing that happens is the nerves that come out each side of the spine also get irritated and over time start to shrink down and die. And so obviously this is something we, number one, want to prevent from happening, and if it's already happening, we need to get this treated as soon as possible before permanent deterioration of the spine happens and causes even more problems down the line. So next up, I'm going to show you a very simple and easy stretch or test to find out if this pelvic rotation is actually what's causing your back problems or your sciatica. So here we go. Okay, now that we have a good understanding of what pelvic rotation actually is, I'm going to show you the easiest test to find out if in fact pelvic rotation is causing your sciatica or your low back pain. So So the way the test goes, and I want you to be super precise when you're doing this, is to start with, I want you to sit up nice and straight. Give me that perfect posture. Then, next up, I want you to take your ankle and put it directly on top of your knee. All right? Make sure you're really lining that ankle up with your leg. Then just let your leg relax down. You see that my leg can actually go mostly in a straight line. This is a good indication that your hips are nice and flexible and able to do what you need them to do. Next up, what you want to do is keep that big arch in your back and bring your chest down to your leg. The number one thing I don't want you to do is try to bring your head down to your leg like that. Again, we're bringing our chest down to the leg. As you stretch down, if you start to feel a big pull or any kind of burning sensation right here in that hip area, it's very likely that that muscle imbalance that's causing pelvic rotation is in fact the reason why you're getting that sciatica and low back pain. With this part, I want you to do both sides, and if you need to stop and rewind to make sure you're doing it with exact right form, go ahead and do so now. If you are noticing that pain or burning sensation in the hip as you're doing these tests, my recommendation is for you to come in and meet with me so that way we can work to make sure we're getting rid of this pelvic rotation that's very likely causing your pain, because again, not only does this pain stick around and doesn't get better like a lot of people hope, it actually will start to get worse and cause long-term degeneration of the spine the longer it's left untreated. So if you are noticing that pain in the hip with this stretch, please don't hesitate to schedule an appointment with me so we can start working on this pain and get rid of it once and for all. Thank you, and I can't wait to meet you.